Great. Well, thank you, Chairman Catania and members of the Committee on Health. I'm happy to share with you some additional noteworthy efforts of the HIV/AIDS Administration to build on the testimony by Dr. Vigilance. My name is Shannon Hayter. I'm the Senior Deputy Director of the HIV/AIDS Administration. And I think maybe to start off a little bit, it is our official and fact-based opinion and position of the HIV/AIDS Administration that HIV, in fact, is the virus that causes AIDS. And we think the work we're doing here is very important to both stem new infections with HIV, but also importantly make sure everybody who is already infected with HIV knows it and gets all of the resources and supports and tools they need to live a long and healthy and illness-free life whenever possible. And as part of that, it's really my privilege to work with just such a strong network of community providers in all sorts of technical expertise areas. We heard from some of them here today, and that's a privilege a lot of jurisdictions don't have. So that background predicates the examples I'm going to go into a little bit more further. So specifically, one of the main areas where we think we've made a lot of progress here is in routine opt-out voluntary HIV testing. HA has made considerable strides in advancing routine voluntary HIV testing. The district is the first jurisdiction in the country with a policy that all residents between the ages of 14 and 84 should get tested annually. In FY08, we increased the number of district-supported HIV tests by 70% from under 40,000 tests tested in FY07 to over 70,000 tests in FY08. In that same period, we nearly doubled the number of young people tested overall. We're the first city in the country to start a new program where couples can get tested and receive counseling together, and that started recently with one of our partners here in town. And our focus for FY09 is to fully implement routine HIV testing in medical settings. And here are some of the new steps we're taking or continuing to take to make that impact. One, we will continue to work with our colleague district agency, the Department of Healthcare Finance, to support managed care providers to routinely implement HIV testing as the core part of primary care services that the district is already buying and purchasing. Second, we're starting to work with some of our private health plans, and particularly those that the district already pays for our own employees, to make sure that they can implement this testing procedure routinely as part of primary care services. And third, we'll be continuing to work with our hospitals to make sure that the new law to reimburse for testing in emergency rooms, thanks to the mayor and the city council, is fully implemented and, again, drives the routinization and the access to testing in ER settings as well. We'll also continue to do outreach to our private physicians, OBGYNs, and other medical provider and practices to make HIV as routine as cholesterol and blood sugar screening. At the same time, we need to also empower our district residents to make sure their doctor is doing an HIV test. We find that some people may think they've been tested for HIV just because they've seen a doctor and had blood taken, but that doesn't mean that they've actually had been checked for HIV. So just as we've learned from some of the drug companies and direct-to-consumer marketing to ask for the purple pill, every district resident should be able to ask their doctor, did I get an HIV test? Are you offering me an HIV test? I want to make sure I'm getting what I need to stay healthy. Lastly, though many people in D.C. actually say they've been tested at least once, here in D.C., where we have extremely high rates of HIV, once is not enough. We definitely recommend that you get an HIV test every year. Second example that took off in FY08 and we look to capitalize on in FY09 is a series of service enrollment blitz campaigns. This is in recognition that we have a lot of services in the District of Columbia, that there are probably more people who need to utilize them than aren't necessarily currently accessing them. So to share new steps HA has supported to rapidly increase enrollment for care and treatment programs, I'll share the following: to connect or reconnect persons living with HIV to services. These can be thought of as service enrollment blitz campaigns. One blitz campaign, designed and implemented by a key community partner, focused on re-enrolling HIV-positive clients that had fallen out of care. A second campaign, directly managed by the HIV/AIDS Administration, aimed to substantially increase enrollment, including recertification and maintenance of participation for the AIDS Drug Assistance Program. The two were highly successful, and here are some specific results. First, the re-enrollment campaign focused on bringing persons back into care for an access to a cluster of services, including primary HIV medical care, medical case management, substance abuse services, and mental health services. Overall, one provider who developed this model identified nearly 450 persons who had fallen out of care during the past 5 years, made strong efforts to repeatedly reach out to all of them, and resulted in nearly 70% of those folks being found, connected or reconnected care by the end of a very short 4-month period. Second, HA launched its Free to Treat Your HIV campaign that included advertising across 20 media outlets, including public transportation advertising. The campaign ran approximately 1.5 years and generated the highest enrollment in the district's ADAP program ever, with more than a 50% increase in the overall enrollment from baseline. Finally, what does it mean that we're increasing the number of people in HIV care services through our successful diagnostic treatment and normalization of HIV in this city? Well, as we are getting more successful in increasing the number of district residents routinely tested for HIV, and improving our linkages from testing to initiating treatment, and increasing our rates of treatment retention. Many of our strategies directly contribute to continued progress in these goals going forward for 2009. As we become increasingly successful, we anticipate our successes to result in an overall higher number of persons in the district actively and consistently utilizing and benefiting from HIV care services. Meeting the needs of success will require ensuring that all provider and payer systems, especially Medicaid, Medicare, DC Health Alliance, and the Ryan White Care Act monies, work seamlessly together to support the full coverage and consistent high-quality services for our district residents living with HIV. We're putting this into practice every day, and we look to make continued gains through these collaborations so that we can ensure we deliver on the promise that we are here to make sure district residents have access to the best and most life-saving care there is for HIV.
Thank you.